603 number, which is also one I don't recognize. Are you a member of the media? Good morning, Sonia.
Good morning.
Somebody dialing in from a 603 phone. I don't know, it'll be our mystery caller this morning. Great. I think most of us are on, so let's get rolling. We have not a ton of time together this morning. I think we have about 45 minutes together. And I am our moderator, just here to help make sure that there's room for everybody to participate in the conversation this morning. Congressman and Lizzie, thank you so much for pulling us all together this morning. We're really excited to talk to you all. I was thinking it may make sense maybe to do just a quick 10-second introduction of everybody, if that would be helpful for you, Congressman, and I can just call on folks.
That's a great idea.
Okay, terrific. So I'll just call on people in the order that your boxes appear on my screen, just to make that a little easier. So Alyson, do you want to start?
Sure. Hi, I'm Alyson Grzyb. I am the director of the Bennington Early Childhood Center.
Hi, Alyson.
And Morgan?
Hi, Congressman. I'm Morgan Crossman. I'm the executive director at Building Bright Futures.
And Aly?
Hi, Congressman Aly Richards, CEO of Let's Grow Kids.
Yeah, hi, Aly.
And Ellen?
Good morning. I'm Ellen Drolette. I live in Burlington and I have a family child care program.
And Courtney?
Good morning. My name is Courtney Fitzpatrick. I'm often known as Courtney Farrell. However, in my work life, I am the Director of Child and Family Services at LUND Family Center, which includes our early education program.
Great. And Amy?
Good morning. I'm Amy Johnson. I'm the director of the Parent-Child Center at Northwestern Counseling and Support Services and the president of the Vermont Parent-Child Center Network.
Thanks, Amy. And Beth?
I'm Beth Truzansky. I'm the Deputy Director of Building Bright Futures.
Thanks. And Matt?
Matt Levin, the Executive Director of the Vermont Early Childhood Advocacy Alliance.
And Donna?
Hello, Congressman. I'm Donna Bailey. I'm Director of the Addison County Parent-Child Center. Hi. And I'm a member of the Executive Committee of the Parent-Child Center Network.
Great. Thanks. And Trey?
Good morning, Congressman. Trey Martin. I'm the General Counsel and the Chief Strategy Officer at Let's Grow Kids.
Great. And Nancy?
Morning, I'm Nancy Bloomfield from the Family Place Parent-Child Center in Northern Windsor County.
And Paul?
Good morning, Congressman Paul Behrman, Director for Champlain Valley Head Start and Chair for Vermont Head Start Association.
And Nicole?
Good morning. I'm Nicole Haley, Senior Manager of Public Relations for Let's Grow Kids.
Thanks, Nicole. And I'm going to take that opportunity to just let both the Congressman's team and Nicole know that we have Chris Mays from the Brattleboro Reformer, April Barton from the Free Press, and Green Mountain Access TV on recording and listening in.
Great.
Sonia, do you want to introduce yourself?
Hi, I'm Sonia Raymond. I'm the Executive Director for the Vermont Association for the Education of Young Children, and I also own a program, childcare program in Stowe, Vermont.
And Deputy Commissioner Rebecca.
Good morning. I'm Stephen Rebecca from the Child Development Division, part of the Department for Children and Families.
Great.
How do your mom?
And Melissa.
Good morning, I'm Melissa Regal-Garrett. I'm the Policy Director for the Child Development Division for the state of Vermont.
Great. And then Maria Richards from Let's Grow Kids is also on. She's my technical support this morning. And Lizzie, here you are. Hi, Maria. Lizzie, I don't know if you wanted to take a second to introduce yourself too.
Hi, I'm Lizzie Haskell, and I work in Congressman Welch's Vermont office.
Great, thanks. So I thought it would make sense this morning, Congressman, for you to take a couple minutes first and just give us sort of an update And then we'll launch into some updates from folks on the call about what's happening with emergency childcare, the stabilization work happening here, some of the other supports for kids, and then the federal support.
Right. Well, first of all, thank you very much. I really appreciate the opportunity to visit with you, and I'm really looking forward to hearing about your work and about your suggestions on going forward. I want to maybe talk about two things. One, just what's happened, and two, what our response is, and really a third, what's our opportunity here. You know, it was only 2 months ago. It's less than that. And March 14th. That is not a long time ago. The House of Representatives was on the floor at 1 in the morning on Saturday, and we were voting on the second COVID-related bill, which at that time seemed like a big one, $100 billion. And it had some paid parental leave in that for folks that got COVID, and it was for all families. We went to the Senate, and it got narrowed down. You had to be out as because of the coronavirus, and it had to be a family member, and it had to be a situation where your kids were home because the schools had closed. Obviously too narrow. But what was so stunning then versus now is that we had on the floor at 1 in the morning all 435 or so members of Congress and probably 100 staff. Even though that afternoon, the day before, on Friday in the afternoon, I was in the Energy and Commerce Committee where Dr. Fauci was testifying, telling us about social distancing. Okay, so we didn't do it. But when I came home, it was in full force in effect here in Vermont. And this is around when our governors, including Governor Scott, were really taking the lead on the steps that had to be taken in order to protect our health and safety. And of course, the consequence of the social distancing, which we accept here, is absolutely essential when you're dealing with a pandemic. But the collateral consequence of that is we turn off the economy, we turn the lights off. And it has had a profound impact, obviously, on every aspect of life. And fast forward, I had to go back to Washington last week on Wednesday when we were voting on, it was the fourth bill, and we were putting more money into the payroll protection plan, more money in the hospitals, and finally some $25 billion into testing. When I came home, I was on the way to the airport. We got a call. Am I still planning on taking the plane? It was a 10:30 flight. Well, the answer was yes. And they said, well, as soon as you get here, we're ready to leave. I was the only person on the plane. Can you believe, literally the only person on the plane? I don't know if people can see that, but that's, I don't know if that's showing up, but I am, well, I won't waste your time. I'm literally the only person in the entire plane.
That's wild.
But so what does that mean back here in Vermont? Every family had to start contending with the challenges of not working, of taking care of their kids, of educating, doing the homeschooling. Folks who had paycheck to paycheck were really, in addition to the anxiety about whether they or somebody they love would get sick, they had to worry about the financial anxiety. And in response to that, something in Washington happened that was really obviously pretty significant. Within a week, we voted on a unpaid for $2.2 trillion package that was largely negotiated by two famous old friends, Nancy Pelosi and Mitch McConnell. So it shows how there was an overwhelming bipartisan response to the economic impact of this. And we included in those bills some money, but not enough money, obviously, for childcare and to some extent for family leave. This was the first time, and this is where I think there's some opportunity, where there was a serious discussion in Congress and included both parties that acknowledged that there had to be a way to publicly finance people staying home because they were sick as a result of COVID, or the coronavirus, and they had to have some capacity to be home paid if they were taking care of a family member. So that's actually where I see us to have some opportunity. What has been exposed here with the impact on all of our society is that we don't have the social insurance programs at the national level that are absolutely essential for the well-being of families. You guys have been on the forefront of that advocacy, and we have an enormous amount of debate and discussion and progress because of your efforts and others here in Vermont. But my view is that this issue of what is a social insurance program, and shouldn't it include families, whether it's the coronavirus or it is some other illness or some disruption in the economy for other reasons, that there is a system where we can provide good childcare for our kids, where we can have paid family leave if a family member, relative is sick. So that's where I see us to have some significant opportunity, because everybody is affected by this. And it's not an ideological battle anymore. It's not even about what's, quote, the role of government. It's like, how does a family and how does a community survive if we don't have the childcare? Like, for instance, now with the essential workers having to go to work and they can't stay home, and who's going to take care of the kids of the essential workers? But it doesn't apply just to this situation with essential workers. What you know is that every family has to have some confidence that their kids are going to get they're going to get good quality daycare where they're going to learn and socialize and do all the things that you do day in and day out with your advocacy. So this, I think, is an opportunity politically to make the case that you've been making for years and years about the importance of having that social insurance safety net. And I think it has to be largely a responsibility to the federal government, not to administer the work. You guys do the work, but to make sure that there is funding available so that we can provide the services that are necessary. Now, I know one of your concerns is what's going to happen going forward. We'll have a debate on this, but the big opportunity for us, but it's where the political debate is now starting to join. Do we provide in a next aid package money that goes to the states? And my view is, and this is, I would say, our caucus view very strongly believes this, we have to help the states. There'll be devastation economically if we don't. And as you know, in Vermont, but this is not unique to Vermont, we've had a huge impact on our revenues. They plunged, and a huge increase in our expenses. And my view is that what our next package has to include is significant money to the states with significant flexibility. So where there's some opportunity for you, I think, will be if we're successful in Washington in sending money back with flexibility, how is Vermont going to use that? And that's going to be a debate in Montpelier that's decided by our legislature and the governor. And my hope would be that we'll take a little step back and take a look at, all right, what is the system we need to put in place to really strengthen this social insurance program that we all know we absolutely need. Now, that's the debate, because what Senator McConnell recently said, maybe some of you saw, was he thinks the states ought to declare bankruptcy, which is truly bizarre because it'll have enormous economic impacts. But what it's, I think, a resistance to is his fear that we may actually use the money for good things that help help our families back home. So I'll stop there and open it up for your questions and comments. But I do want to say thank you. I have so many good memories of working with people like Donna Bailey years and years ago when I was in the State House, and Sarah, you too, as well. And Matt, of course, is there, and I work with his dad in Congress, and it's really good to be with all of you. Thank you.
Thanks so much, Congressman. You're saying the words we want to hear for sure in terms of the support that we need from the federal government. Aly, did you want to just take a minute to talk about sort of how Vermont is faring in the national context?
Yeah, Hi, Congressman, thank you so
Hi,
much
Aly.
for being here and for everything that you're doing. You're making us quite proud as always to be Vermonters. We're also very proud to be Vermonters right now because of the response that we've seen in childcare. So just a quick overview, and then we'll turn it to the other folks in the on the grid here, such as it is. So, you know, just one quick story to make the point of how we've sort of attacked this immediately with alacrity and creativity and grit, as you would imagine. You know, we had a Let's Grow Kids staffer, Dee Dee, who went to Champlain Valley Union. They donated every shred of toilet paper and every last Clorox bleach bleach wipe, because they're closed, you know, for the rest of this year, obviously, to the folks who were doing childcare for essential employees. And that added to the list of stuff from 7th Gen and Repro and Vermont Glove and Twincraft, as you know, people literally changing their production lines to create hand sanitizers and soaps and disinfectants. Folks down in Rutland pulling across pallets in Foley distribution so that they could repackage them in smaller packages to get to these childcare folks. A call from Foley to us saying, please let the governor's office know there's a friend in childcare down here in Rutland, right? I mean, so getting then those supplies to the folks, for example, you know, up in Almond Blossoms in Franklin County, the Y, you know, for UVM medical employees who are open, doing essential work, you know, in as safe as possible way, because this administration, you know, came together and provided for, you know, the finances for them to do the care for essential workers. So 30% actually of all regulated childcare is involved in some capacity in the care for essential workers right now in Vermont. And they're able to be open because they're not worried about going bankrupt. That's the second thing. So beyond the emergency care work, we are still the first in the country, Congressman, to have said as a state, we will not let our childcare industry go bankrupt. As you just said, it must be here when this is all over. And so the stabilization program is one tool in the toolbox of many, so that really these folks are, you know, these programs are held financially harmless through this. So that's just the anecdote to say, this is Vermont. You know, we are leading the charge on this, but it's not without its pain, as you well know. Nothing is easy. Nothing is streamlined and straightforward in times of, you know, pandemic response. So parents are still paying, you know, 50% of their tuition in many cases to stay enrolled. You know, it's a great deal compared to the rest of the country. It's still financially painful for many, right? There are many things like that. You know, folks who are sacrificing being on the front lines, not having health insurance and being asked to do this. So all I'll end by saying as we turn to our folks here to tell you what's happening on the ground is, thank you. You preempted the conversation of the world just got a front row seat to the importance of childcare. The absolute necessity is not an accessory. It is the backbone of a functional society for the equity of our children and families and for our economy. And so what does that mean? Let's make it a cornerstone of any real recovery. Right? There's huge opportunity here. I'd love to hear the detail you're already putting behind it. So we'll get more into that as we discuss today, but I just wanted to say we're with you on the opportunity, absolutely. And again, really proud of the Vermont response that so many you're about to hear from are key members of.
Great. Thank you, Aly. That's great. Cornerstone. I like that.
Yeah. Yeah. So we wanted to talk first just a little bit, Congressman, you alluded to this, to the care for essential workers that's happening right now. There's sort of been two components to the response here. And I wonder if Deputy Commissioner Rebecca can just, or Melissa can give us a quick overview of what that is, and then we can hear from some of the folks providing it on the ground.
Thank you, Sarah. And good morning, Congressman. Good morning, colleagues. The Child Care Financial Stabilization Program and the Essential Persons Incentive Program, they support the statewide regulated childcare system to ensure that childcare programs will be ready to reopen when the governor's closure order is relaxed or lifted. And we anticipate, as Aly said, that childcare will be a critical piece of the state's economic mitigation and recovery efforts. And these programs are funded by the CARES Act, and we're grateful for your support of this important legislation. There are several providers and other stakeholders on this call. And Sarah, I think Congressman would like to hear from them.
Thanks. Thanks,
Great.
Steve.
Alyson, Sonia, Courtney, I think you're all providing essential worker care right now, right? Does one of you want to talk about, or all of you want to talk about what that's been like for you?
I can start. I first of all just want to thank you, our administration, and you, Congressman, for the support of the stabilization fund so that we can continue through this. That has been critical for us and allowed us to really focus on how do we best support our children and families. As a director, I really struggled with the idea of reopening for essential worker children initially. You know, this is a field that's been underfunded and at times underappreciated, and what we were asking our teachers to come in and do felt like a big challenge. And so it was something that we really took time and maybe a little bit more time than our teachers wanted. They were ready to get going. They wanted to do this. And I wanted to make sure that they were well supported. So we took a little bit more time in planning. We ramped up slowly. We did it in a way where we felt like they were, they had the support that they needed and that the children had the support that they needed. We know that children, you know, are struggling, especially during this time. The world doesn't make sense to them and they don't have the words to talk about their feelings. And so that is something that we've been paying a lot of attention to. How do we do this in a way that will well supports families, but also well supports children? And I would say that that's, you know, as we think to the future and about our ability to reopen our centers to even more children, that that weighs heavily on all of our minds. How are we going to do this safely, and how are we going to do it so that we're best supporting children who, you know, will be experiencing all kinds of trauma and will be coming back to childcare, but to a different type of childcare and a different kind of social safety network that they're not used to. That's going to look different. I would just say, in terms of the field, this is a field that deserves this attention and deserves this support. Again, they were the first to say, "I'm ready to go. I want to do this." Even though I don't know what that means for me personally, even before we knew that there would be additional pay to recognize that, they were ready to go. So I think those are my quick thoughts.
Thank you very much.
Yeah.
Alyson, did you want to chime in on that too?
Sure, briefly. We are open for essential childcare, although the majority of our families have opted to use family members or whatever to care for their children. What I have found super helpful about the stabilization program is that all of our staff are working from home to stay connected to the families, and we're able to still pay them. And I think that's really fantastic. They're creating curriculum, touching in with their kids all the time. It's really been fantastic. A big worry for me is everybody wants to come back to work. We all want to see the kids and hold those kids and hug those kids. But there is a big worry about what that's going to look like and how that's going to feel.
Right.
But I'm glad that we're being supported by our state officials. So thank you.
We're not going back to the old days for a while. So all of us are going to have to make adjustments in whatever we do. But I can imagine how hard it would be not to just embrace those kids when they come in.
Tanya, I see you're already unmuted. Go for it.
Yeah, I can say ditto to both what Courtney and Alyson have said. It is a very different world and a different way of doing things. We've settled into a routine with the kids that we've had for several weeks now. However, we wouldn't even be able to be doing this, to be honest, without the state funds and this program.
Right.
And the staff here that are doing it, as others have said, didn't do it because they were getting extra money, because they weren't when we started this. So it is really just because this is what they love and this is their passion and they want to be here. And they've put together an incredible program, as have all the other teachers that we have been providing continuity of learning for our infants right through to our after school folks right along for several weeks now virtually. And it's been pretty incredible. I too think a lot about when we reopen, if you will, And I think that's going to need some very significant planning about how that's going to happen,
Right.
and how we're going to launch and do that well and safely for everybody. I think it's going to be an absolutely huge adjustment for children to come back. I think for the kids that have been here, although they're settled in now, I think that'll be another huge transition for them. So I'm always very sensitive to all of those things.
Mm-hmm. Well, good luck on that.
Thank you.
Yeah.
Thanks. So a few people have referenced the stabilization program that's happening here as well, Congressman. I don't know how much information you've had about what Vermont is doing specifically in terms of supporting programs that are closed or for kids who aren't actively enrolled right now or actively attending. Would it be helpful if the somebody from CED, either the Deputy Commissioner or Melissa, talked a little bit more about what that actually looks like?
Definitely would. I mean, it's pretty impressive what Vermont has done in many areas, but this very, very much is important. Go ahead.
Even or Melissa, I don't know who wants to hop in on that one, but.
So the state of Vermont has established 2 programs, a stabilization program that is voluntary and an incentive program for providers who care for the children of essential persons.
Mm-hmm.
We have gone through a couple of pivots since first starting the programs, and as we have learned more about the available funding from the federal government, we are continually reassessing the programs to make sure that they meet the needs of Vermont's families. Melissa, would you like to provide some additional thoughts on that?
Yes. I mean, is Melissa going?
Yeah, sorry, I'm technical difficulties. I have 2 unmute buttons because I have to call in by my phone as well as by my computer. I know. So with the stabilization program, you know, it was pretty powerful to be part of the decision around closing childcare programs, to be in the room with the Secretary, Mike Smith. His main concern really aligns a lot with your Senator around what does it mean if we are closing down this industry and ensuring that the industry is alive and well on the other side as Vermont looks to rebuild and come back out of this crisis and its impact on our economy. So, you know, the real heart of that stabilization program really is a value on the importance of childcare to all industries in Vermont. And I think it's a real marker in time for us who've been part of advocating for this field for years. The program is really designed, it's rolled out in 2 phases, and that's a real response to our evolving understanding of the length of this crisis and the closure period. So phase 1, we were able to provide 100% of tuition on behalf of families that were unable to pay. Families were asked to cover their tuition, but those that were unable to, the state stabilization program came in and provided that 100% tuition. One piece of the stabilization program that's remained consistent is our child care financial assistance program. We shifted from an attendance basis to an enrollment basis, which essentially meant all children that have been enrolled prior to the crisis in child care financial assistance, we continue to pay their tuition on behalf of those families. And that's been consistent. And then finally, phase 2, again, as we were looking at the long-term impact of closure, you know, we needed to be sensitive to what the state could afford. And we ended up reducing the state support for tuition down to 50%. And we asked, you know, families to come in and cover the other 50% cost of those slots. And so, you know, that's been an ongoing piece of our long-term rollout. The Federal CARES Act funds have gone all completely 100% into the stabilization program. Between stabilization and the Essential Persons Program, we're spending, Deputy Rebecca, you can correct me more specifically, but I think somewhere in the 1.4 $5 million per week range. And the majority of that is on stabilization. It's not on the essential persons. I think we're roughly, maybe at 900, 800,000 a week on essential persons. So with that, the roughly 4.5 million we got through the CARES Act, we've already gone through it.
Right.
So we have a gap in terms of how to cover that cost. And I think that's really, as you are working to enhance support for states, that's a real place that you could, we could use that. And again, we are turning our attention to reopening and what that means. Sonia Raymond really spoke eloquently to the need for a transition in. Transitioning in a reopening comes at a cost because providers need their slots filled in order to maintain financial stability. And if we look at just simply the fact that many of our providers providing essential care have families that they are serving that they don't typically serve, they're taking up the slots of other families, and we need a reorganization. We need potentially a week of time where families just return to their programs, but that will come at a cost if there are empty slots that aren't filled while we make that transition. So, even the reopening could be a way that the federal government could be supporting the states and the child care system and families going back to work.
Thank you. That's good.
Thanks, Melissa. Ellen, I don't know if you wanted to talk a little bit about the stabilization program and what that's meant for you. So Ellen runs a family child care home, which, as you probably know, Congressman, is a key component, especially in rural states like Vermont, of our child care infrastructure.
Right.
So thank you for the opportunity to be on the call today. So I was not able to do essential care because I spent a significant amount of the winter sick. So I have to tell you that the field in general in Vermont has immense gratitude for the stabilization. It has meant that we've been able to really kind of spend this time focusing on professional development, focusing on keeping connections with families, giving them ideas of how to spend quality time with their children in between trying to work and trying to balance everything they're doing, sending them articles to read. So I think that it's given us time to not have to worry about paying our bills and being able to still focus on, doing things that we can do at home while we have this time. So, painting our childcare space and cleaning things out and doing professional development. There's been a ton of professional development that we've been able to do online. So I think that having those opportunities has been amazing. So the time has not been wasted in that sense. We all miss the kids terribly. I think the sense among early childhood educators at this point is there's a lot of anxiety around, the expectations when we do open, and will we have what we need in terms of supplies to do the things that we need to do, and will we have them in time? Will we have enough? And then what does that look like? What does it look like in a family childcare home if you can't distance yourself, or the kids obviously can't distance themselves? So, there's a lot of, I think, anxiety and angst around that concern. And honestly, I can't imagine it. I have a parent on this call, and I'm sure she can't imagine social distancing either. So there's some anxiety for sure around that. So
yeah.
Thanks, Ellen.
But thank you all for keeping childcare at the forefront. So appreciated.
Yeah. As you're talking about sort of the anxiety and the supports for families through all of these transitions, I also want to make sure we have a few minutes to talk about some of the other supports that are in place for kids to access childcare, or that a lot of kids actually access through their childcare programs. And I don't know, Amy, Morgan, Paul, I think all of your programs provide a lot of those services for kids. So I don't know if Morgan sort of like, help support folks at the state level. I don't know if you all want to talk a little bit about that. Amy, did you want to kick that off?
Yeah, I can kick that off. So thanks for being on the call, Congressman. I think that it's really important to think about when you mentioned turning off the lights as a nation, and thinking about turning off the lights for childcare for a lot of our really vulnerable families, and what that means for children who see childcare as a place where they do feel safe, maybe the one place that they feel safe, a place where they have caring adults, a place where they're able to work on social emotional development, know that there are boundaries, know that there's a structure in place, know that they'll consistently have food. And what does that mean when the lights are turned off for so many of our vulnerable families? And also knowing that childcare providers are often the lifeline for families to supports and services throughout the state of Vermont. And what will that look like when kids who have been home and not having access to that support, what will that look like when kids return? And I imagine and some of you had mentioned the trauma that kids are experiencing in the homes, increased abuse, neglect, exposure to domestic violence, and the dysregulation of kids that we'll see coming back into care, and what providers will need and families will need on the other side of that, and the human services surge. And what I'll say on behalf of the Parent-Child Center network is that we are thankfully doing a wonderful job of staying connected to those families who were engaged in those systems. We have been able to maintain through telehealth our connection to families through Children's Integrated Services. Many of us hold that contract. Our Parent-Child Center Master Grant also allows us to support families in the perinatal and postpartum period into early childhood and into adolescence. And we've been doing a multitude of things, whether it's checking in with families over the phone, providing therapeutic services through video conference. We've also made sure that families are connected to the concrete supports they need to be able to meet basic needs through delivery of items, delivery of activities. So many of us have created activity boxes to deliver to doorsteps so that families are able. Pardon?
I love that, activity boxes. That's great.
Yeah, I know Donna Bailey, her center's done a really wonderful job of that, just being able to make sure that families, not only the food, the clothes, the formula, the diapers, working with our local diaper banks to make sure that people have access to concrete supports, but that also making sure that when I'm on a phone call, like right now, and my child's in the other room, and she's not going to run in here and jump on my lap, but you might, that she has engaging things to do, because we know that not all families have access. There's transportation barriers. If a family has a compromised immunity and they can't get to the store, so we're going to the store for families. We're buying what they need through gift cards or what have you, and then delivering those items to families. So we've been able to maintain a really robust system of staying connected to families, which has been incredibly important to mitigate the risk and impact of what's happening for families in the home, especially those very vulnerable families who no longer have that connection, direct connection to childcare, where is that healthy, safe place for kids to go.
That's great. That's really great. Thank you.
Donna, did you want to add in a sentence about the family support?
I did. I think that's the thing is, as we know, and thank you, and I concur with everything that's been said, but I think the big thing is that when we're talking about young children, we're talking about families. We can't separate those. So when we're talking about the economy, we're also talking about families. So there's so many things that I think we have the opportunity to learn from here. But I think when I look at this and look at supporting families in rural areas, we are getting boxes out and activities, and like Amy said, the activities, this past box that we focused on were art supplies, along with instructions and simple supplies and recyclable materials and not messy, so parents don't get mad, things like that. And now the toy store in Virgins, that manufactures stores, toys, saw that we were doing that, and now we're sending out toys in our next box because they're donating them. So there's lots of great things happening, and I think it's important to remember that you know, local response to individual families is really critical, as well as the systemic supports that we're getting here. And I think that's where we're learning and growing in this. How do those come together? Infants and toddlers, some really different strategies needed than pre-K. So I think that's really important. In infant and toddler care, most kids are staying home, and we really need to think about that. Many of our caregivers / teachers are also parents. So like Amy said, we have kids, you know, here that we're also trying to homeschool. We're not just working from home, you know, we're also
Right.
So that's really important. I think the big thing with families too, and I want to say this because it's not specific to childcare, but the need for internet access and phone service is critical. So many of our families do not have that, and therefore the homeschool thing is really challenging, and they don't have data on their phones. They have text-only phones, things like that. So that sort of infrastructure is critically important. Not to mention not attaching healthcare to jobs, but you know, that's
right.
But thank you so much. And I think we're all going to have an opportunity to learn a lot here.
Right. Paul, was there anything you wanted to say specific to Head Start supports too? I know,
Sure.
I know Head Start was included in some of that funding. So.
Yeah, thank you, Sarah. And thank you, Congressman Welch, for all you're doing in DC. Much appreciated, the voice of reason on the Hill. We're very appreciative. I want to mention just a few quick things from a Head Start perspective, and then a few things while we have your ear from an advocacy perspective. One is just sort of globally, and I'll come back to this. I am struck by the distinction between publicly funded systems and services and privately funded systems and services, and the stark distinction between, for example, K through 12 versus the birth to 5 industry right now. And so I think it really, this whole experience just brings that all into focus. And I think as you mentioned from the outset, it really presents us with an opportunity. So quickly, just a Head Start recap, 2 of the 7 Head Start programs in Vermont have established emergency childcare. They are both in the southern part of the state in Brattleboro and Bennington. Thanks to U.S. Department of Health and Human Services, Head Start nationally has assurances in place around wages and benefits through the end of June currently. My program's been collaborating, I think, with, in addition to potentially people on the phone, a number of providers throughout the region to identify families who lack that support, families with essential workers, and to try to provide them with that support. I'll just echo all the things that Amy and others said about virtual supports for children and families, deliveries for children and families. We've got all of those activities in place. To Donna's point about technology, we've identified families, and these are low-income families through Head Start, that don't have any technology access. We've got an iPad loaner program in place going on right now to provide that connectivity, especially for those social emotional supports. And then the last thing I just want to mention, coming back to my initial comment, I think that this is an opportunity for us to revisit the conversation around full public funding for birth to 5 services. This experience has really borne out the precarious nature of the industry, and I think it's because of the largely privatized component. Right. I'm still for a mixed delivery system, as I think everybody else is. At the same time, you know, the public funding is really what has assured stability, both for Head Start and for K through 12. Right. But there have had to be a lot of stopgaps put into place to support this really critical backbone of our society, and that needs to change. I think this is our opportunity. Thank you.
Thank you. Thank you, Paul.
Thanks, Paul. Aly or Trey, did one of you want to say just a word to Paul's point around some of the federal supports that are in place and that we know are needed?
I'd be happy to jump in. Thanks,
I think
Sarah.
she's pointing at you, Trey.
Yeah, I got the point. Thanks, Congressman. You know, obviously for the industry here in Vermont, the overall goals haven't really changed. We are pushing for the highest quality programming we can have in the state. We want it to be affordable for all parents, and we need there to be access for all parents. That means we have to have enough slots for every family and every child who needs a slot. National advocates are pushing, we understand from our partners, they're going to be pushing a really robust number. They'd like to see $50 billion in the next stimulus go to childcare across the country. And formula funding in Vermont, that might be, about 10 times what came in the last round, or a little bit more than that. Our concern, I guess, would be that's going to get eaten up by the emergency costs so far. So it's enheartening to hear that we could have some flexibility, that there might be other ways that the state can make decisions and prioritize some of the investments. And there are so many investments needed for our childcare system in Vermont. As great a job as we're doing, we've spent the last 5 years with the group on this call, from Building Bright Futures and the Vermont AEYC to Head Start and the Parent-Child Centers to Let's Grow Kids, documenting those needs. There was a Blue Ribbon Commission report in 2016 and 17. There was a think tank report a couple of years later. So it's all very well mapped out in terms of a sort of a future state that we'd love to push for. But in the immediate short term, when we think about what we do besides backfilling the costs of the stabilization program and the emergency childcare, our IT infrastructure needs a serious shot in the arm. It's part of a 5-year plan, but the funding is really up in the air right now for those kinds of, what it's like to be in that corner office downstairs making those decisions. And one-time funds are pretty squirrely right now. Families are really struggling right now more than ever. Affordability is a key. And when you think about how wonderful the stabilization program was, and then the fact that we have asked families to continue to pay 50%, and that's been a rub for many people out there. It has been really hard for programs to ask for that and for some families to do it. The state is willing to step in if families can't pay, or centers can decide not to, but those are tough choices. Until the IT infrastructure is rebuilt, it's hard to increase our CCFAP enrollment, but there may be other ways to provide grants to support families and expand eligibility at this time. We have to mention, and it's every opportunity we say, we want to mention that childcare workers and teachers are the lowest paid professionals in the state of Vermont and across the country. So if we have flexibility to do something right now, it has to be in the mix that we would provide some kind of support, whether it's a temporary support system or some way of injecting more funding into the system. And you've heard from folks on here, just to finish this off, and I'm going to hand it off to Morgan, who may have some additional ideas. But it is terrific that a lot of programs have taken advantage of this time to increase professional development and do trainings. But over the course of the next 12 months, it would be great to inject money that we had called for at the beginning of this legislative session into loan repayment, into tuition assistance, and to just creating the world has shrunk. We're all availing ourselves of these online platforms. What can we do to increase quality in our centers by giving people access to more training and ideas and resources, even if it means doing it through Zoom? So there's a whole lot there. We appreciate the opportunity to tell you all that. And I know it's overwhelming to get so much info on one call, but
it's very helpful.
We have a little bit more to add.
Okay, thank you.
Morgan, did you want to? Yeah, go for it.
Great. Thank you, Congressman. I'm Morgan Crossman. I'm the Executive Director at Building Bright Futures. And Building Bright Futures is the public-private partnership that serves as Vermont's State Advisory Council on Early Childhood. And many of our council members are on this call right now, which is great to see. But our role in the system is to be the state's neutral convener. So we bring folks together at the local level, at the regional level, at the statewide level to be collaborating on behalf of children and families. So we've developed statewide forums dedicated to specific topics. We're also monitoring all of the needs that we're hearing statewide within regions and elevating those to our agency partners, to the governor, and to the administration. And we also, again, serve as direct advisors to those partners. And so one of the things I wanted to outline quickly for you is what we're hearing on the ground as emerging themes and priorities. And you've heard a lot of these throughout the call today. Childcare being a primary concern, but recognizing that the state has made such incredible investment. We're hearing other things emerge now because we've done such a great job in the childcare arena. So we're also hearing about food security and basic needs, right? So we're talking to families who are in need of diapers, wipes, baby formula, growing resilience on our food shelves, and promoting the use of WIC and SNAP and school food programs. We are also very focused on family safety and mental health. And so again, this is happening in the child care arena, but it's also happening, and we're seeing this interplay across all of our different service systems statewide. So we're seeing challenges for families and caregivers, as well as folks in their home, really needing to connect people who are isolated. We're hearing mounting economic pressures and risk for domestic violence and abuse, and long-term impacts of trauma. We are also hearing major needs in the healthcare arena. So access to health insurance for children and families, access to health insurance for those who are on the front lines and are really trying to figure out how we do a solid job on telehealth. And especially given the growing concerns of our pregnant and postpartum women, right? So access to lactation and home visiting and mental health supports. A ton of concern around families of children with disabilities and special healthcare needs, and how do we support those families and kids in their homes, and making sure that they're connected. We're hearing a lot about technology, right? So there's limited or no connectivity for families who are in the rural areas. And thinking about continuity of learning in this moment, and recognizing that our birth to 5 families are in that same boat of trying to figure out how do we provide learning experiences for our kids who are now home, and supporting parents, educators in this distance and remote learning, and setting appropriate expectations for doing that based on the child's age. And then finally, we're hearing quite a bit about reopening and recovery. So really thinking about what the next steps are in terms of clear guidance and expectations for the process, and how we in the early childhood arena are able to support the governor in Vermont to be able to do that well across all sectors. So, at Building Bright Futures, we are funded both publicly, privately, and through federal dollars. And we are seeing such a great need for investment in early childhood for all of our different partners, everyone on the call here, and even further to support kids and families. So thank you for everything that you're doing right now.
Thank you. Thank you.
Thanks, Morgan. Congressman, I think you have another meeting you have to get to in a couple minutes, right?
I do, yeah, but this is really terrific. It really is terrific. But go ahead.
I was just going to say, I wondered if you had time for a question, if there were any other sort of burning questions
Sure,
that
yeah.
for you,
Yeah,
or anything that you needed clarification on.
No, but I can make a couple of comments. This is extremely helpful. Just number one, it's extraordinary that we have this infrastructure is represented on this Zoom meeting across the state that is evidence of a long-term commitment that we've had here in Vermont against great odds to provide that childcare ages 1 through 5 that is so essential to getting an opportunity for a bright future. And unlike a lot of other places around the country where they just don't have that infrastructure, you've provided it, and not with it, very insufficient public support. So we've all been blessed to have the benefit of your dedication and professionalism over the years. The second thing is that this question of the next phase is really challenging. In listening to you, everything you do is so concrete. It's everything from getting the facility to be clean and safe. It's looking at what the practical needs are of each family. Some who need diapers or food, or getting gift cards so you can help have them be secure during this interim period. It's so concrete, and your capacity to focus on those practical details that are necessary to make your facility work and to help the kids and help their families. I really appreciate that and admire it. It's not an abstract discussion. It's a concrete reality day in and day out. But third, this crisis, economic crisis in healthcare crisis, is different than the bailout of Wall Street when the whole financial system collapsed. And the focus on that bailout, unfortunately, was to revive the banking sector a lot of discontent about it, but if the banking sector failed on Wall Street, then it had real impacts on Main Street. But there's a lot of bitterness looking back about how everyday people got left out of that recovery. And this recovery has been much different. It's got problems, to be sure, but the focus on unemployment insurance, the focus on having money in there for childcare, the focus on, for the first time, having paid family leave, now very limited related to this coronavirus, but the focus on the small businesses, again, some abuses there, but there's a awareness in the public debate that I haven't seen in Congress that everyday families need supports. I mean, families right now where they're working, if it's a single parent family, it's really, really hard. Two-parent family, even there economically, it's a real challenge. And there needs to be that social safety net or those social insurance programs that we talked about. And what has happened in this country is that we've allocated so much of the profit, and corporations have never been more profitable since the Great Depression. But labor has never received less of the profit than since the Great Depression. And of course, these tax cuts that we have been passing that have been totally focused on the very profitable corporations and very wealthy individuals. There's much, I think, more openness to the debate that, hey, wait a minute, we've got to have a system that allows for the security and well-being of our families and our workers. And Paul, I think you mentioned it, that debate is being joined because in this pandemic, where families across the country, red states, blue states, were all similarly affected, and where the response that we must have to protect our own personal health and safety depends on how other people act. And our ability to protect ourselves is going to benefit other people by our social distancing, by our hygiene, by all the things that we have to do for some time to get through this. So this is a challenge that brings in opportunity to be making the case in a broader, more powerful way that you've been making here in Vermont about the importance of that social safety net, that social insurance program. So that's where I see my role in Washington, is trying to inject that debate and that sensibility into the discussion. And it's there among many of us, and obviously not all of us. But I do want to give you my best appreciation. You've done hard work, but the work that you're going to be doing next, where all of us are going to be managing the best practices, where we're going to be taking that step out of the cocoon of our total isolation. You know, Margaret and I have been here in our house, and there's been some sort of emotional security for us because we've been very, very careful, and the same for you. But when I left that and went back to Washington, as careful as I was nervous. And that's going to be a feeling all of us start to experience as we come out. And we won't have any guarantee, because it's not as though when we tiptoe out of the social distancing back into the world, carefully and slowly, like the governor is recommending, the virus will not be there. It'll be there. But we'll be in a position with our health systems up and running, with our social practices, to probably be able to manage it. But you're going to be managing it where there's heightened anxiety, parents leaving their children, entrusting them to you. So that is fraught with emotion and anxiety, and you're going to have the burden of managing that with your own concerns, but also concerns about the kids and the parents. So that's a big, big job that awaits you as the lights go back on. And I salute you, but hard work ahead for all of us, and let's do it together. But let's put front and center the point you've been making. We need this social insurance program. We need significant, stable public funding to make certain that families have the security that their kids are going to get good care in their earliest years. So Sarah, thank you so much for letting me be part of this meeting. And I want to thank each and every one of you for your wonderful comments.
Thank you, Congressman. We just want to say thank you again so much for your insights, your time, your leadership, and for all of you for your thoughtful sharings for the Congressman today and all the hard work you're doing on the ground. And we stand ready to support you in anything you need from the ground to make this case, and frankly, to be a test case, to be a leader as a small state with this infrastructure that you mentioned, to show the world what happens when you get it right.
Thank you.
So we really do stand ready to be your partners in all of that.
Thank you, Aly. Thank
Thanks
you.
to everyone for your time today and all your great work.
Thanks, Sarah. Bye-bye,
Yeah,
everybody.
we'll be in touch.
Thank you.
Yeah.
Take
Thank
care,
you.
everyone. Thank you.
Bye-bye.
Bye.